Congenital muscular torticollis is a condition caused by the shortening of a neck muscle called the sternocleidomastoid. Torticollis, on the right side, causes your baby's head to tilt to the right and rotate to the left. Physiotherapy has been found to be an effective treatment of torticollis, and the earlier that physio is started, the better the outcome. Management may include stretches, tummy time, or even changes to the way that you and Bubs do daily activities, such as carrying, feeding, playing, and changing Bubs. If we start with feeding, this can be done regardless of breast or bottle feeding. If Bubs has a right-sided torticollis and their head turns to the left, we want to feed them so their head turns to the right. This means feeding primarily with their head in your left arm. This way they can feed breast or bottle with their head turning to the right. Alternatively, if they are bottle fed, you can hold them in your right arm, turning the bottle so that it's away from your body, causing them to again look to their right. If you're then thinking about sleeping or changing, have the room set up to the right side of Bubs, which will encourage them to look to the right, to the exciting side of the room. You can also take the opportunity when you put them down for a nap to set their head up so they are looking to the right side. Don't be worried if they move their head out of that position though. When you're playing with Bubs, have toys or people situated on the right side to encourage looking towards the exciting side of the room. This can occur both in back play and in tummy time. When it comes to stretching out Bubs' neck, there are multiple different ways to do this. The important thing is there are two parts to stretch. The first is to correct the head tilt. To do this, place both of your hands cupping Bubs' head, then gently move their head towards the left side. The second part of the stretch is to correct the rotation. To do this, hold the left shoulder and gently rotate the head to the right. If their neck is a bit stronger, you can also do this in sitting. While stretching Bubs' neck, it's not about pulling as hard as you can. It's about gently bringing their head into a slightly stretched position and holding there for a few seconds. If Bubs has some neck control and they don't like the stretch on the floor, you can also hold them up towards your face over your shoulder on the left side and use your face to block them from turning the head to the left, causing them to look towards the right. Some different ways to carry Bubs include what's called the football carry. To improve the head tilt, hold them with their head in your right arm. Then, reach through their legs and grab the bottom side, with the head going uphill into your elbow. You could also hold the bottom shoulder down more, or hold the head up with your hand to increase the stretch a little bit.